So I don't know if I have an extreme fear of flying or if I'm just trying to be frugal, but this is now the third time I find myself driving from Utah to Oklahoma. This time though, it's to buy a house. In medical school, I've come across a list of words that you hear all the time. Some of them, it's obvious what the definition is. Others, I've had to look them up, but I've kind of collected them, and I wanted to share that list with you on this drive. Gunner. This is a term reserved for that overzealous student who's preoccupied by studying, acing the test, getting the teacher's attention, showing their superiority over the rest of the class, and ultimately just trying too hard. It's hard to define exactly what a gunner is in one or two sentences, but when you meet one, you'll know exactly what I'm talking about. And when you become one, you'll know it too. Pimping. It stands for put in my place. This is when a doctor or resident over you starts asking you a bunch of questions about what's going on to test your knowledge. Or they're actually trying to see how you think on your feet. And they may very well ask you a question they're certain you won't know the answer to. They want to see how you respond and how you react. So this is an opportunity where A, if you get the question right, you can really impress. Or B, if you get the question wrong, they want to see what you're going to say. So my advice is to always have a clever response and be ready for pimping questions at any time. My clever response was usually something like, ooh, okay, that's definitely something I want to read about more, but I can take a guess, and in that way, they show that I can at first admit that I might not know the answer, but then by taking a guess, they can see my thought process, and I'll usually talk my thought process out loud. And then the last thing I'll do is I'll always whip out a pen and a notebook that I keep on me, and I'll write down that pimp question, and I will sincerely go home and look it up. Practical. This is an exam that will most likely involve physical specimen, like in gross anatomy, asking to identify certain structures on a cadaver, or in microbiology with slides of tissue or bacteria that you need to identify, or even in a physical exam skills testing, asking you to perform specific maneuvers to test for like an unstable shoulder or a neurological deficit. SP, this stands for standardized patient. This is a paid actor that comes to your school or wherever you're testing, and they pretend to have the symptoms of a normal patient. And this includes everything from like a sore on their arm, or like a vaginal infection. So there are definitely paid actors for breast examinations, pelvic examinations, prostate examinations, as well as everything that is non-invasive like that. But ultimately, your school or program will use SPs to test you on your ability to take history and to perform a physical examination. Boards. Boards is one of those things that changes depending on the time of life you're in. But typically for medical school, boards are the standardized testing that allow you to advance to your next stage of education. And mostly you're talking about the USMLE. Step 1 is the first stage that happens after second year of medical school. Step 2, which is a 2-part test, computer-based and standardized patient-based, happens after third year of medical school. And then step 3 happens during your first year of residency or intern year. And so for osteopathic students or DOs, there's a different board certification or a board test, which is called the COMLEX, and they have level 1, level 2, level 3 that coincide exactly with steps 1, 2, and 3 for the USMLE, and the tests are seen as pretty similar in general. And then beyond that, there are also boards for becoming board certified in your specific specialty. and I don't know anything about those other than you have to pass those boards in order to be a licensed physician in your specialty, and you've got to take those every 10 years to recertify. So boards are massive tests, 8-hour tests that you have to take just as a necessary evil. Allopathic. Allopathic is one of those words that I think are used more by osteopathic physicians, but allopathic essentially means an allopathic medical school is a school in the US that gives an MD degree, versus osteopathic, which is a medical school in the US that gives the DO degree. There are also osteopathic schools outside of the United States that give a DO degree, but it is not seen equally as an MD degree in other countries as it is in the United States. AMCAS, ACOMAS, and TMDSAS. Those are all acronyms for application services for getting into medical schools. AMCAS for MD schools, ACOMAS for DO schools, and TMDSAS for all Texas medical schools, both DO and MD. Internship. That's a fancy word for the first year of your residency. So you can do a couple different types of internships. One is a categorical internship, or your intern year, where you are actually rotating, or you're actually doing your internship at the hospital and where your program is, where you'll do specialty training. The other one would be a transitional internship, where you're going to do your intern year somewhere else. That year will be spent in either internal medicine or surgery at a different hospital, and then when you begin your specialty training, you'll go to a different place. So you'll move someplace for intern year for a year, and then move again for the rest of your residency. So an intern, or someone in their first year of residency, shouldn't be confused with an internist or an internal medicine doctor. Residency is the 3 to 7 years after medical school, where you go to get specialty training, whether that's in primary care like family med, internal med, etc., or whether that's in a different specialty like anesthesiology, for example, ENT or whatever. But during your residency, you're actually a physician, but you're just not board certified in any specialty just yet. Some states allow you to practice medicine after your intern year, like practice solo or do primary care. Other states require a minimum of 3 years. PGY is a distinction that means postgraduate year. So it's usually the initials behind your name after MD or DO. You would say you're a PGY1 during your intern year. You're a PGY2 during your first year of residency. In my case, my first year of anesthesia residency. I'm also called a CA1 when I'm simultaneously a PGY2. But if I didn't take a direct route to my residency and I changed my mind halfway through a different residency, it might be that I'm a PGY3 when I'm a CA1, or a first year anesthesia resident. I'm sure there's other things kind of like CA1, 2, and 3 for anesthesia. There's acronyms like that for other specialties as well. I just don't know them. But it's an important way to distinguish how many years you've been out of medical school. When you say, I'm a third year resident, that might not mean as much as I'm a third year resident PGY4. Fellowship. Fellowship training is additional specialty training after residency. So, for example, cardiology or gastroenterology is a fellowship of internal medicine. And if you're an orthopedic surgeon, you can get more experience in hand surgery with a fellowship or something like that. Now, fellowships can be board certified or they can be unofficial, as far as I understand. And so they're good opportunities to become more specialized. Attending, this means you're done with all postgraduate training and you are the boss. So it's a doctor who's done with residency. So there was just a few words there that it's nice to be familiar with. You probably heard most of them. Sometimes they can be confusing if you hear them and you don't really know what they mean. At least that's the way it was for me. I was always confused about, what's an intern, what's a fellow, what's an internist, what's an attending, that kind of stuff. If you guys like this video, let me know in the comments, click thumbs up, and I'll be sure to make more. As always, thanks for watching, and stick around for more great videos.